second presentation. Our second presenter, who is also a great friend of mine, is Dr. Karim Johari. He is a assistant professor and researcher in the Department of Communication Science and Disorders, and he leads the lab on human neurophysiology and neuromodulation. He's widely recognized for his cutting-edge work on neural correlate of speech and limb motor control, and his research on the impacts of aging on this function is quite fascinating. Dr. Johari is also leading expert on speech and language impairment in Parkinson's disease. He employs both invasive and non-invasive electrophysiology methods in his research, as well as neuromodulation methods such as the TDCS or TACS. And he also incorporates machine learning and computational modeling to gain a more comprehensive understanding of the complex interactions between motor system and the language. His contribution to the field of communication science and disorders have established him as a rising star in the study of neural basis of speech and limb motor control. Today, he will be presenting an exciting topics of motor language interaction, and the title of his presentation is Causal and Clinical Evidence Support Motor Language Coupling in Neurotypical Adults and Individuals with Parkinson's Disease. Dr. Johari, floor is yours. You have 30 minutes for your presentation.
Can you hear me?
Yes.
Oh, sorry about that. So for some reason it doesn't. Yeah.
Okay.
Okay. So thanks for having me, and thanks for the introduction, Dr. Bakhtiar. So it's a pleasure to be with you guys. So I have like about 30 minutes, you said, for like 20 minutes and 10 minutes for question. Is it correct?
You have 30 minutes for presentation and followed by 5 minutes of Q&A.
Okay.
Yeah.
Okay. All right.
But we appreciate it if you go a little bit concise, because like we are a bit behind the schedule.
Yeah, I'll finish in 20 minutes hopefully, and I'll be interested to hear the question. So thanks for having me. So and sorry about the technical issues. So today I'm going to discuss about most of my work is focused on like the motor control and speech production, but at the same time we are interested in my lab and with my colleague to explore how the motor system interact with the cortical and subcortical regions, in cortical and subcortical regions with the language, particularly action language. So. And we did like some research like since 2019, and I'm gonna be presenting some of my findings and in healthy subjects and patients with Parkinson's disease. So, motor language coupling. I mean, I don't use term embodiment because embodiment it goes like through like lots of like different aspects of the embodiment. So you have like in the sensory aspect you have embodiment, and you have like in the action domain. But mainly what I mean with motor language coupling is that the action language are grounded in the motor system. Basically, it's the premotor motor area and the subcortical region through the dopaminergic system, basically. And several line of research support this hypothesis and view. You can find as the earlier discussed with our keynote speaker that there are lots of like fMRI studies showing that action semantic is like processed and also in the motor related regions in the brain, and these are coming from like a large scale meta-analysis and also like fMRI studies showing the evidence that this is like a actual like a functional fMRI findings showing that. So let's see how we move to the next slide. So I don't know. Okay. One of the famous studies that I am really in favor of, and it's in the neuroimaging studies that, for example, with the Hawk et al. 2004 in Neuron published, and they showed that if you use like words that are related to the hand motor hand functions, such as like throwing, or like if any object that you're writing with that actually. So like a pen, I mean, for example, it's activated like the hand motor areas in the brain. And in the panel A and B, in the figure here in the top, you see that those like red areas, those are like for the hand movement on the A when they're like using hand movement, and in the B it's the same area they show like overlap when you use like for the arm words. I mean, for example, throw, or like writing or eating, or like using like even nouns. I mean, so, and they show like co-activations, and there's like significant overlap. The same scenario is true for when you apply and as subject like the name, like foot verbs. I mean, or like foot nouns, such as like to kick, or like any object that you use, like your leg or like foot to move them, such as like ball, for example, the ball. I mean, you kick with your leg. I mean, usually. So those areas, like in shown in the blue in both A and B. In the A, they just like move their feet, and it shows like activation close to like the leg area in the M1, and you see the co-activation in the B for the when they naming that. So basically, there's like a large overlap in this like in it like a study. So if we move to the next slide, uh, beside these like neuroimaging studies, you have clinical evidence that I'm more in favor of than the neuroimaging studies. Uh, uh, in the If you assume that the motor system is involved in the uh, action language processing, like the words that have like higher motor content, then it's reasonable to assume that in the movement disorders that affect subcortical network, you will see more impairment in action word processing. And there are like evidence for that actually. So like lots of evidence that showing that the patient with Parkinson's disease have a hard time, like have more difficulty in naming, and also in lexical processing of like action verbs than the non-action verbs. Like for example, action verbs, we will say that to throw, and non-action to think. And also, patient shows this deficits more pronounced in these patients when they are on medication. So it's very common in the PD patients and Parkinson patients that we turn on like they avoid their medicine for like 12 hours, and we call it like off medication, and basically dopamine is depleted, and you test them during that time, and usually they show like a worse performance. uh, Sorry, I put it wrong here, so it should be like off versus on. So means that when the system is like depleted and there is no dopamine, uh, patient shows more deficits than when there is a dopamine in the system, basically. Then, interestingly, in 2019, my colleague Angela Roberts published a paper in Cortex, interestingly, showing that when you have patients that, because the Parkinson patients have like heterogeneous symptoms, you can find patients that show more severity of like motor symptoms in the upper limb, in the hands and arms, than the legs. And you can have like more patients that shows like more lower limb symptoms, motor symptoms. And interestingly, she find that the when you have patients with more lower motor symptoms and more severe motor symptoms in the lower uh, limbs, in the legs and feet, such as like freezing in the gait and having a hard time to initiate the walking, you will see more impairment in the uh, action related to the foot. I mean, for example, to kick. And similarly, she showed that the patients with the more severe upper limb symptoms have more deficits in the hand related verbs, I mean, such as like to throw or to write. So these led us, like most of these studies came from the either English speaking languages, like English speakers, or like European language. We don't have that much cross linguistics evidence. So in 2019, we can go to the next slide. So in 2019, Um, I conducted a study with Michael Olmand at Georgetown University. So, like, I was that time like in Iran. So we collected some data in non-demented patients for the Parkinson patients, non-demented patients, and for the healthy match subjects. And we just collected like naming of objects that manipulated versus non-manipulated. Because based on the embodiment theory, you would assume that also like the objects that have more motor content, such as like hammer versus elephant, which has like a less motor content, will be more impaired in Parkinson disease. So we don't have that much of evidence about this part, and there are like few studies. So we tested this part of the like the motor language coupling of Parkinson disease in Farsi speakers and for the PD patients. And not surprisingly, if you look at this is like only on the accuracy, and if you look at the log odd transformation of the accuracy scores, I mean, for the PD versus normal control, which is like NC, you see that the significant difference in the manipulated objects, worse performance for the PD patients than the non-manipulated. In the non-manipulated, it's notable that they also have lower score, but it's not as more pronounced than the manipulated objects. So we showed this in the patients with Parkinson's disease in Farsi that you actually have impairment in manipulated objects, supporting this hypothesis that we have actually that the striatal motor premotor cortex like network is involved in the action language processing. Then uh, we had like a couple of other questions about that whether uh, motor system or motor cortex involvement in the language action language processing, it's only literal. So that's another question that we had with my colleague Rutvik Desai at University of South Carolina. I did my postdoc there, and we collected we had like interesting question that if you use like the action verbs, we most of the time every day use action verbs, I mean, uh, in the context of like a not literal, like figurative way. I mean, like for example, the holiday is approaching. I mean, for example, or uh, uh, we can say that the question caught the teacher off guard, for example, like idiomatic sentences. And you can use like a metaphoric in the metaphoric way, like the Congress proud poured more funds into into the problem. So all of these, the interesting question was that if we stimulate left motor cortex using high definition transcranial recurrent stimulation in healthy subjects, what would be the outcome versus sham? I mean, so, and we tested this in like 24 subjects, healthy subjects, and we collected data in two sessions of like cathodal HTTDCS and sham session with a week apart approximately. And we collected in 20, as I said, 24 subjects. And we purely focused on the reaction times and accuracy. Not, I think this one has only like a reaction time. So in the here, like on the right side, I show like the model current flow based on the electrode I used, I mean, to send the electrical current through the skull. And in the top you see that we are like almost targeting the M1, but as this is just like a important note that to know that even though this is like high definition, but it's very likely to breach into the like surrounding areas. So it's not as precise as like TMS in targeting the areas, and it doesn't cause any change in the behavior immediately. So always the change following the HDTDCS or TDCS is gonna be like more subtle, and like you will see either in reaction time or accuracy across the trial. So you will not see in real time. You stimulate N1, M1, and you see just like immediate change in the behavior. If we go to the next slide, I mean, so We had like multiple sentences that included literal, like we used action verbs in the literal context and idiomatic context and metaphoric context, and we compared the reaction times for with the visual verbs, that the verbs like such as like to observe and to notice, to detect, and we use those as like, because if they based on the what the embodiment theory, if that there is like such a thing that the visual words should like embodied in the like visual cortex, then the stimulation of the M1 should not affect them the way that will affect the uh, action words that requires like the limb movement. uh, so here we are showing the results of the reaction times, like in milliseconds, following cathode and sham, and we are comparing three panels, like three conditions versus visual uh, sentence, sentences with visual verbs. And what we see is that overall there is like an increase in the reaction time for visual verbs, interestingly, across the three conditions. And that it's there is a like simple explanation for this, that because that you are stimulating M1, you're affecting the reaction time, because they required to respond with their like right hand on the keyboard. So like you're affecting that more precisely, more significantly for the visual sentences. But when it comes to the literal, the same thing is not true, because you're facilitating that actually. So slightly for the uh, literal verbs versus like visual, when you see in the cathodal, there is not that much difference, but in sham you see a big difference across the conditions, I mean, between literal, idiomatic, metaphoric versus visual verbs, I mean. So, and if we move to the next slide, this is like this is the main finding that I want to like emphasize on it. It's that the when you compare the action verbs that used in idiomatic, literal, or metaphoric context, or like sentences, you don't see that much of difference, particularly for idiomatic and literal. Following the stimulation, it shows like similar pattern of the reaction times. Um, Both of them like showed like relative facilitations compared to the sham. I mean, so if we go to the next slide. Um, So in the summary for this study is that I suggested that like the action word processing facilitated through stimulation of left primary motor cortex. But the main finding is that the motor cortex involvement in the processing of action language is general. So it's independent of that if you use them like in literal way or in figurative way. And in the other study that we were interested, so we asked the question that if you want to test it in general action words, I mean, so like in the previous in the first study we looked at the action verbs, I mean, in three different contexts. But here we were interested to test the action words, I mean, meaning that we were going to look at the manipulated objects and non-manipulated objects, and also action verbs versus non-action verbs. And we were interested in two different areas in the brain. That one of them is like the primary motor cortex, or like left M1, and also like a higher order motor cortex that less studied in these kind of like embodied cognition studies, uh, particularly anterior left anterior intraparietal lobe. I mean, so that region is involved in the motor sequencing, motor planning, and there are like studies showing that this is if there is a damage that in that area, you will like patients will experience like some sort of like apraxic behavior, such as like a limb apraxia, or using like their limb in like more voluntary method approach. So in 42 subjects, we tested this with a between subject design, looking at if you stimulate M1, what is going to happen, and if you stimulate AIPL, what's going to be happening following the stimulation for action verbs and manipulated objects. Just like a note that these were like two separate groups, and we were not interested directly to do everything within the same group. I mean, because it's going to take like 4 or 5 sessions, but ideally it would be the best design. I mean, so And also, I'll use like a HMA here as a like hand motor area. That was the most voxel that we could model the current there with the most intensity. So we stimulate the hand motor area. So we had like two main tasks that involved in here. It was like a shallow semantic task, which was like lexical decision. Subjects asked to make a decision if some words make sense or not, and they were like composed of the action verbs and non-action verbs, and manipulated objects and non-manipulated objects. And the more like deep semantic task, I call it, not shallow. I mean, like a semantic similarity judgment. I'm showing here in the slide that you will see there is a word on the top, which is your target word, and you have two probes at the bottom, and you will ask subject that, okay, to tie, which of the two options at the bottom are close in the meaning to the target, which activates more deeply the semantic system. So, and we collected data like in two different blocks for each task, and subjects came like in two different days with a like interval of a week apart. I mean, so on the right side here, I'm showing the different stimulation for the active stimulation, which is the cathode elements. If we go to the next slide, uh, uh, what we showed here is that I'm showing just like a net accuracy and net RT, which means that if you subtract the sham from the cathodal here, and because the data were skewed, we just performed some normalization using z-score, and then we subtracted the RTs, RT of the sham from the RT of the actual cathodal stimulation. So what you see, the more positive here on the reaction time will mean that there is the reaction time got longer, or like the patients, like subjects got slower after stimulation. And if it's like more negative, means that they got faster after stimulation. For the lexical decision, which is like a more shallow task, if you look at on the top row, I'm showing for the left hand motor area, and at the bottom it's for left AIPL, which is like in the parietal area. So what we are finding is that if you stimulate the hand motor area, AIPL, it significantly increased the reaction time for the manipulated objects compared to the non-manipulated objects. This was the only significant finding after correction for multiple comparisons. But for the LD, there was like some trends of the results, but it was not significant. So, and similarly for the semantic similarity judgment, when we asked them to judge about which word is like more close in the meaning, has a more like similar meaning relative to the target word, we saw that the net RT significantly decreased if you stimulated the motor cortex, because it's negative. I mean, means that the cathodal was faster than the sham across the 21 subjects in the hand motor area. We don't see the same effect following the stimulation of the left AIPL. And eventually, we looked at the accuracy, how much they were accurate, and we just like found the results for the lexical decision that it made them worse for the action, non-action verbs, actually, when you stimulated the hand motor region, and they showed increase in the accuracy for the action verbs following the stimulation of the left AIPL. So in overall, the results are not really like in the same line. So it's more, there is some facilitation for more deep semantic tasks following the left hand motor area. But for the left parietal area, when you stimulate, you only see more facilitations here on the RT for the manipulated objects. So if we go to the next slide, so the conclusion is that from all of these three studies, especially with the two first studies, I mean, the third study was like a bit mixed of findings, but for the first study, like we use that action words is impaired in PD, but we didn't have that much of like evidence from the understudied language such as Farsi. And we showed that both from previous study, both action verbs and manipulated nouns are recruiting the corticostriatal networks. And this is like interesting point because as patients make progress, you see the more impairment, and in the early stage you don't see that much of problem because that the degeneration hasn't been extended to the motor cortex, so it takes a while. So if you find studies that showing that this is not the effect in the PD patients, the first thing that I would check is that I will look at if the patients are like in a good stage of the degeneration of more cortico-thalamo-striatocortical network. I mean, basically, it takes a while. So if you test patients in the early stage, like stage 1 of Parkinson's disease, they look pretty normal. I mean, so like it's more like subtle differences. I mean, so. But if our patients here in this study were like a moderate to severe patients, non-demented with Parkinson's disease, so it was it's worth to note. I mean, if you like interested to test Parkinson patients. And our second study showed that the motor system supports for the action language is both literal and figurative. So it doesn't matter that much that if you use like a verb in the content in a sentence, if it's like a literal or figurative, the meaning of the sentence or the like the context of the sentence, it doesn't matter. So it will recruit the motor system. At least in this study, our results suggest that. Future studies obviously will require like to replicate this finding. And also, like I suggest that based on that third study in the AIPL and hand motor area, I will suggest that the both primary and higher motor cortex support action language processing, but more of the AIPL is more involved in the manipulated and objects than non-manipulated objects. And the reason is that there is like a TMS study recently showed that the you see the activation of if you do the TMS over the left AIPL, you will disrupt or like interfere with the processing of the visual objects that have higher visual spatial components, like objects that requires that you manipulate it with your like hand. I mean, such as like a pen versus like chair that you don't modulate that much. I mean, with your hand. I mean, so obviously. So overall, these results suggest that there are causal and clinical evidences obviously across the languages and also across the domains. I mean, that it's not only the action verbs, also it's like action words we will use from now on. So it's both like manipulated objects and action verbs. So I think that's it. And here's my collaborators, Rutwik Desai, University of South Carolina, where I did my postdoc, and I worked closely with Michael Oldman at Georgetown University, and we published several papers together, like on different speech, like particularly language and syntax and morphology in Parkinson's disease. And my colleagues, Nick Riccardi at University of South Carolina and Miraj Moody from University of Georgetown, Northwestern University. And that's it. Thank you for your attention. And if we move to the last slide, this is my contact info. We are always looking, obviously, for motivated people to join our team. So shoot me an email if you're interested. And that's it. Any questions? I would be happy to discuss.
Yeah. Thanks a lot, Dr. Johari. We really appreciate your great presentations and then addressing all the questions.